Hello, my name is James Wall. I am a practicing pediatric surgeon at the Lucile Packard Children's Hospital here at Stanford. I'm also on the faculty of the Biodesign program and a alumni of that program from several years ago. I've had a fair amount of experience with both entrepreneurship as well as medical device development and the institution of clinical trials in Europe, having both lived and worked over there extensively. I'd like to share with you some of my thoughts on how Europe is thinking about strategies to compete in the global medical technology market. And I'm going to focus on two areas of importance. Number one is clustering, and number two is multidisciplinary collaboration. So the first concept is clustering. This is obviously bigger than medical technology. The question always comes up, do Detroit, Hollywood, and Silicon Valley matter? And people have argued both ways. Many people say that with globalization, infrastructure, with the internet, that there really is no need to be in a specific place anymore. However, these kinds of places still seem to matter. And a great example in the medical technology space is Warsaw, Indiana, which many people may have never heard of. However, it's home to three of the largest orthopedic companies in the world and has remained a competitive location for orthopedic implants despite competition from around the world. So this points to what's called the paradox of location, which has been elegantly described by Michael Porter from Harvard Business School. And essentially what he has argued is that paradoxically the enduring competitiveness in a global economy lie more and more in local things, as opposed to the argument made by Thomas Friedman that the world is getting smaller. And the paradox of location really says that knowledge, relationships, and motivation that distant rivals can't match are offered by local expertise. So why is clustering important to Europe? All of the examples I gave you on the last slide are glowing successes in the US market, but has Europe done the same? The answer is they've struggled a little. Part of European struggle is certainly cultural diversity. Having both language and cultural barriers makes regionalization within the entire EU challenging. And on top of that, the classic university models of Europe, which are often mimicked in the US, are high output, competitive with each other, and trying to drive diverse research as opposed to specialization and sharing of information. So how can Europe change and how can it develop clustering? Well, the building blocks as described by the Milken Institute to develop regional critical mass for medical technology and other high-tech industries are access to capital, government incentives, cross-fertilization of leading technologies, quality of life, cost of living, being in a good place that's attractive for people to live, educational and research facilities, which the Milken Institute argues is the most important factor, although others would argue differently. And that's the example of certainly Stanford being within Silicon Valley and being an engine for innovation, as many have argued. In addition, for a cluster, you need modern infrastructure, access to the internet, transportation to get people to and fro. And ideally, you would want manufacturing and supplier base locally. So are they doing this in Europe? Well, they're certainly trying. This is a map of France, and as often with the French, they're a little bit all over the place. But these are clusters that have been developed by the French government in the last 10 to 15 years, focused on multiple different areas, from aeronautics to nanotechnology to biotech. And a couple of them you'll notice in Strasbourg, the Alsace Bio Valley is really a government incentive program without a specific focus, whereas the Lyon Biopole is actually focused just on infectious diseases and their prevention. So they've taken multiple strategies and tried different approaches within these clusters. Across all of Europe, there's about 168 self-proclaimed bioclusters and about 41 recognized as having more key components. They've developed both organically and by policy-driven examples, and I'll talk about two of those briefly. Galway, Ireland is an example of policy-driven medical technology clustering, and in Galway there was really a diverse expansion of companies driven by tax incentives. So essentially, the Irish government was able to attract a large variety of companies, including Boston Scientific, Medtronic, and others, brought them in with tax incentives, generated on the order of about 4,000 ongoing manufacturing jobs, and then from that local expertise has been able to start the process of generating new ideas, innovation, and new companies. Tuttlingen, Germany is the opposite example, where it was really organic growth. The Karl Storz company started in Tuttlingen many years ago and was really focused on expertise in optics. So it was really a tool that could be used in many industries. As the company grew, it turned out that that expertise was focused on the medical field in both laparoscopy and endoscopy. And the company rode a large wave of growth in both of those areas and have leveraged that into a very large multinational corporation. However, locally around them, there's been a lot of growth of startup and innovative companies which have brought products to the Karl Storz platforms. So in 2006, the EU commissioned a report or a study on the effects of clustering. The leaders of the EU thought it was a good idea but wanted some data behind it. I won't go into detail, although it can all be found online. But what the ultimate conclusions were that clustering clearly correlates with local prosperity. And what they showed was that areas where less than 25% of jobs were based on clustered expertise, the mean income and local GDP were low, whereas when you got clustering over about a 40 to 50% threshold, you clearly saw increases in, again, both productivity and mean income. What's harder to correlate is clustering and innovation, and as you will learn throughout this class, innovation is not really a linear pattern. It tends to come in fits and spurts, and it tends to require long-term investment. So that correlation's harder, but the belief is that with clustering comes innovation based on historical examples that we've seen. So what's Europe going to do about this report? Well, it turns out that the European Union or European Commission has actually adopted a funding policy now called smart specialization. Again, this is across multiple disciplines, but does apply specifically to medtech as well. And what they've said is that the significant levels of development funding from the EU will now be focused on regions that demonstrate local expertise coupled with collaborative environments. And what it also says is that areas that do not have local expertise are going to lose funding. So the chances of starting, for example, an oncology company in a region that's known for manufacturing solar panels is going to become pretty low. That company's probably going to have to move to a region where there's local experts. In addition to the top-down approach from the EU, the national governments have stepped in below the European Union and have developed funding programs to encourage this type of behavior to be able to ultimately draw European funding and also gain a competitive edge. And an example of that is the recent French program, which roughly translated is called the Hospital University Institutes, where they're trying to combine large volume hospitals with both engineering and medical universities to drive innovation in medtech. And they're funding those programs based on each program has to give a local thesis of what they are particularly skilled at in that region and what they have the chance of developing to commercialization that can compete on an international level. So that's the story of the clustering and ultimately getting to European bioclusters. The one question that remains, you can build all this infrastructure, you can put people together, and you can fund it, but then the question becomes, where does the talent come from? And I think that's the second part of Europe's ongoing strategy that I alluded to in my title, and I'll speak a little bit about. So Europe is really the center of the classic Western university programs and has remained so. These programs tend to be very vertical I would call them, in that people really begin straight out of high school into their area of expertise, medicine, business, engineering, and there's not a lot of crosstalk opportunities built into these programs. The glaring example for me as a physician who trained in the US is that in Europe, medical students are really isolated from day one of university and go straight onto the medical track, whereas in the United States, all physicians are required to have a undergraduate degree in some other field before they start medicine. Now that isn't the panacea of crosstalk, but it does give some exposure to other disciplines that I think are valuable to the U.S. medical technology market. And I think Europe's realizing that this could be a problem. The solution's probably not going to be in changing the university programs because they're fairly ingrained, but what we have seen is the emergence of a lot of multidisciplinary programs that target students late in their education or early in their professional careers. And a lot of these programs are really following somewhat of the Silicon Valley design team model, where they're taking young professionals, putting together engineers, physicians, people with business experience, and others, and putting them into a team design environment where they can understand the needs of patients in their local markets. They can apply the local expertise that they have and try and put that together into driving innovation. As of 15 years ago, there was no multidisciplinary program that combined more than 2 disciplines in Europe. We've now seen the development of on the order of about 10 to 15 in the last decade. So in conclusion, I think that the key takeaway is that Europe has struggled with regional specialization, and that is, of course, due to many cultural and language barriers. However, the EU has studied this, and they're focusing on it from top down. So there really is a combination of forces driven by the European Union that are encouraging and enabling clustering in medical technology. And finally, if those clusters appear, we need to make sure that, or Europe needs to make sure that they have the expertise and the talent in place. So classic training and specialties is unlikely to change, but multidisciplinary postgraduate programs are growing exponentially and have the opportunity to drive medtech innovation.